Birth Workers USA, a place dedicated to connecting communities, doulas, and birth professionals while sharing evidence-based practices. My name is Erica Reeves. I am a birth and postpartum doula based out of Charlotte, North Carolina, and I want to share some information with you, girl. Hi, everybody. So just a disclaimer before we get started, this is not medical advice. This is information. As always, you should always refer to your trusted healthcare provider with any specific questions concerning your care. Today, we're going to be talking about diabetes, specifically gestational diabetes, as it relates to pregnancy. In 2018, the ADA defined gestational diabetes as high blood glucose during pregnancy. Now, there are other types of diabetes. Some people only have gestational diabetes in their entire life. Some people have prediabetes or type 2, and some people have type 1 diabetes. And we can go over briefly what those all are. So, prediabetes is basically high glucose. So that's when your blood sugar is really high, but not necessarily high enough to be classified as type 2. Type 2 diabetes normally comes from some type of insulin resistance or if the pancreas is not producing enough insulin. And type 1 diabetes is an autoimmune response where our immune system will attack those insulin producing cells in the pancreas. And that is not something that you can get rid of. You can only manage it and watch it. You can only do treatment. But type 2, some people have, been so successful in managing type 2 that it almost seemed like they didn't have diabetes. So according to my girl, Rebecca Decker, over at Evidence-Based Birth, research has found that diabetes, whether it be gestational or some pre-existing form, was the medical reason given for about 10% of indicated inductions. But I would agree with Rebecca that it's important that we know why we're getting induced and what are the risks associated with that. So, according to the research, Rebecca and her team concluded that the absolute risk of perinatal death or the actual chance of the event occurring is very low, whether a woman is with gestational diabetes, chooses to be induced, or follow an expected management plan. So at 39 weeks, the absolute risk of stillborn or newborn death was 9 deaths every 10,000 for people who gave birth versus 15 deaths per 10,000 with expected management for one more week. At 40 weeks, the absolute risk for those who gave birth was about 10 deaths and about 10,000. So basically, it's not a lot of stillborn babies. A lot of people say that diabetes increases the chances of stillborn and birth defects, which there is some evidence to support that, but it's showing that with well-managed diabetes, it's highly unlikely. Now, why is it important to be screened for diabetes? Well, all women experience some level of insulin resistance when pregnant. Also, cesarean rates seem to be lower when induction is at 39 weeks. It's our body's way of prioritizing the baby over ourselves. In the U.S., it seems people of color are at higher risk for gestational diabetes. And although stillborn rates are not very high, they seem to be 2% higher in populations of women that opted out of being tested for high glucose. In the United States, we use the one-step method. So if you've had children in the past, you'll probably remember going to the doctor's office and drinking like a small soda, or they call it the glucose cola. So how it works is you will fast. You'll be told to fast for about 8 hours before your doctor's appointment. So it's better if you just do it in the morning. And you'll go in and you'll get your blood drawn for the blood sugar tests as like a baseline. It's your fasting blood sugar. And you'll be given the cola, so you'll drink that. A lot of people say it's really nasty. I haven't actually had the chance to try it, but there are some alternatives available. You would just have to ask what your provider has on hand. So after drinking the cola drink, about an hour after, you'll get your blood sugar tested again, and then 2 hours after, you'll get your blood sugar tested one final time. And this is to determine if you have gestational diabetes. Also, it was mentioned in Rebecca's article that drinking ice water is not recommended. It can kind of skew the results of the test, and a lot of people seem not to like the taste, so she recommended maybe dropping like a green tea bag in the cup to improve the flavor. This testing normally happens sometime during the second trimester, but if you are receiving fertility treatments, you'll more than likely be tested before you even decide to get pregnant, just to ensure that if you do have diabetes, because a lot of people do not even know until they get pregnant, that it is being managed well, because 9 times out of 10, any symptoms that you're having prior to pregnancy will be exacerbated after and as your pregnancy progresses. So once you stay safe, once you stay beautiful. Okay. If diabetes is something that runs in your family, there are things you can do to prevent getting it, and there are things you can do to manage it, to have a happy, healthy lifestyle, including getting up and walking. Walk every day, y'all. Get up and walk. It's going to be good for not only if you have diabetes, gestational diabetes, but for your pregnancy, for your hip mobility. It's going to be good for you, okay? Get up and walk, okay? And maybe even eating healthy, drinking lots of water. It was suggested specifically with people with diabetes to make sure you're up every 30 minutes, that you're awake, because sitting still can influence your blood sugar in a negative way. So no stagnation. Let's get up, move around. Also suggested to eat fiber-rich food, so lots of fruits and vegetables, lots of fiber that's gonna slow down the sugar entering your bloodstream, and it's gonna. Others have also been able to successfully manage their diabetes with medication, so that could also be an option for you. I'm not sure about during or outside of pregnancy, but that is an option that a lot of people turn to. So definitely talk to your provider, and please, y'all, do me a favor. Go ahead and like, comment, and subscribe to this video. First of all, thank you. Thank you for coming to my first video and sitting through the whole thing. I really appreciate you. Like, you're my favorites. So if you have any questions, anything that comes to mind, anything that you experienced, if you want to share your birth story, please leave a comment down below, or you can send me a direct message. You can email me. You can find my phone number on my website. You can call me if you want to, okay? Because in the next episode of this series, I'm going to be sitting down with a professional, and we're going to be asking all your questions.